Okay, thank you very much, Doppler. Many Americans could be in for an expensive surprise this tax season, a dramatic decrease in their refund. Those who received subsidies under the Obamacare or Affordable Care Act could owe the IRS because credits they received to offset their insurance premiums were too large. That's because enrollees had to estimate their income for 2014, and many didn't know exactly what they would earn. It was also up to enrollees to report major changes that would affect their income, including starting a new job or getting married. People who didn't have health insurance at all in 2014 are also facing a fine. And there are some deadlines we want to talk about. Joining us now, Rigo Chavez. Thank you so much for joining us, the Regional Director of Pegasus Insurance. And so your agency helps consumers find the right plan for them through various health insurance companies, including helping people enroll in health insurance through the Affordable Care Act.
That is correct. We sit down with the clients, we identify their needs, we help them estimate to the best of their ability what their income is going to be for 2015. And based on their situation, we help them determine what kind of subsidy they should be applying for. Once the subsidy is obtained, then they can use that money to pay for the premiums of the premiums they're going to have to pay for the insurance policy they choose.
Okay, today is an important deadline. It's not the last day you can enroll for health insurance under the Affordable Care Act, but it's the last day if you want insurance by next month, right?
That is correct. Anybody who is going to receive a subsidy and wants to be enrolled or covered, February the 1st, today is the last day to submit the application.
Okay, and a month from now is the very last day, like the last day of the enrollment period?
A month from now is the last day of open enrollment, where any American living in the U.S. legally can apply for insurance to be covered starting on March 1st and for the rest of the year.
Now, a lot of people get confused because they hear, every person living legally in the U.S. now is required to have health insurance, then I have to sign up if I don't have it under the Affordable Care Act. But if you make less than $12,000, then you don't qualify for the subsidies with the Affordable Care Act, so you're not going to be fined, right?
That is correct. There's a great concern among many El Pasons where they went to apply at different places and they were told, oh, you don't qualify. It's not that they don't qualify to buy the insurance, it's that they do not qualify to receive the subsidy.
Right.
Now, in order to receive the subsidy, you have to make at least 133% of the federal poverty level, which in rough numbers is $12,000 for one person, $16,000 for two, $20,000 for three. You add $4,000 for every additional person.
Right. So if there's 4 people in your family, the household income has to be less than $95,000, right?
Has to be less than 95 and more than 20,000.
Right.
24,000.
24,000, yes.
Yeah, between 24 and 95.
Okay. All right. Sounds good. Well, thank you so much for joining us. The fine, though, 1% of taxable household income if you qualify for the subsidies and you don't get it, right?
That is correct. Okay. If you had the opportunity to enroll and you didn't get it, that is going to be the fine. 1% of household income for each adult, uninsured adult.
Okay.
And half as much for each uninsured minor.
Okay. Well, Rigo Chavez, Regional Director of Pegasus Insurance, thank you so much for coming and reminding us of this important deadline.
Thank you, Maria.
Thank you. We appreciate it.
Thank you.
We'll be right back.